It's surprisingly common for men to have enlarged breasts. This can happen in younger men just through hormonal changes, or they inherit them, or they've been overweight and lose weight. Often the breast tissue stays. In older age, it can happen just with passage of time. It can happen because of medications. There's some cardiac and blood pressure medications, along with other medications that can affect liver function, which can allow male breast development to occur. It can happen in anabolic steroid users who are doing bodybuilding. For whatever reason, if a man gets male breast development, it's very distressing. And there's really, unless the person's very overweight, not much you can do about it from a non-surgical point of view. So it's becoming something that I do quite a lot of, and I like to do it because the results are very satisfying. The way it's done is, first of all, a medical history is taken and we assess you. In most cases, the breast tissue is prominent and creating the sense of too much fullness, but there's no excess of skin. That is to say, the skin's firm enough that if the breast tissue was removed, the skin wouldn't look loose, it would look okay. In that circumstance, the operation, and this is the most common operation that I do in male breast surgery, is done as a combination of liposuction and tissue removal. The male breast is composed of a lump of breast tissue behind the nipple which pushes it forward, and that lump can be anything from the size of a large grape to a golf ball to a mandarin, or even bigger. Around that is packed fat, and the fat is like an upside down dessert plate. It merges into the normal tissue, higher and lower and inner and outer. And so the idea of a male breast reduction isn't to remove 100% of the breast tissue, it's to leave a flat, even sheet of skin and subcutaneous fat across the chest and giving a good male shape. So the way that I do it technically is to make a small incision in the upper chest, just at really where the rib cage and abdomen meet. Then I liposuction the whole breast, and by doing that, what I do is remove all of the fatty tissue that we need to do and create a good shape. And what it will do is expose the breast tissue, because the breast tissue itself is too dense to come out of the liposucker. That lets me know though exactly what I then need to do to take out the male breast tissue. So the basic flatness of shape is achieved through liposuction. It can be anything up to 500 mils or half a litre of liposuction a side would be quite common. Then an incision's made at the border of the areola, which is the brown pigment of the nipple, and the normal skin in the lower half, and it goes about a third of the way round. Once that's open, I then elevate the nipple off the breast tissue and leave about 1 centimetre of thickness of breast tissue just on the back of the nipple so it doesn't get hollow later. Then through that small incision, by using headlights and long instruments, we carefully remove in little pieces all of the lumpy breast tissue that's creating a contour problem. Once it looks smooth inside, we put the skin down, sew the nipple up, and you've got hopefully a nice flat chest. The same's done on both sides. You then go into compression garments and the operation's over. A lot of local anaesthetics being used and put in beforehand so that you wake up pretty comfortable, and at no point is it terribly painful. You feel bruised and battered, like pulled muscle sort of pain. The compression garment is absolutely critical. If you don't have a compression garment on, if it's not well fitting, and we'll make sure it does, then you can get blood or fluid form under the skin, which can even cause a hematoma or at least cause lumps. So firm compression through these tiny incisions, really breast tissue has been removed in a big area, and so reduction of the risk of any bleeding or lumpiness is the key post-op thing to do. And the key to it is taking it really easy for a week after surgery minimum, and wearing a really good compression vest 24/7. If those things are done, the risk of any bleeding is 1% or less, and it's easily fixed if you get it, but it's much better not to get it. Initially, I'll see you the week after surgery. We'll remove the dressings, the stitches are all dissolving, and you'll see the new shape at that point. It's swollen for a bit, and over a few months, further swelling takes any, causes to, or leads to just a better result. Little bits of unevenness are quite common, but it's pretty reliable to get a good shape. The chance of revisional surgery in male breast reduction is quite small in my practice, which is good. Sometimes the nipple needs to be adjusted if it's still too prominent. There can be little skin wrinkles, but in general I find it to be a reliable operation with a really high patient satisfaction rate. There's a group of men, older men with a lot of breast tissue, who need skin reduction, or massive weight loss patients who need skin reductions as well as breast tissue removal. And that's going to lead to a visible scar on the breast, and really it's a whole another discussion which we'll have in the weight loss area in due course.